Colon cancer is a serious disease that affects millions of people worldwide. Often, it is diagnosed in its later stages, which makes it more difficult to treat. However, early detection can drastically improve the prognosis and treatment outcomes. Being aware of the early warning signs of colon cancer can make a significant difference. In this video, we'll dive deep into the top 10 early warning signs of colon cancer, backed by factual studies and information. So, let's get started. 1. Persistent gas and bloating. Experiencing excessive gas and bloating can be a sign of colon cancer. These symptoms can occur when a tumor causes a blockage in the colon, leading to a buildup of gas. Persistent gas and bloating can be uncomfortable and often embarrassing. For instance, if you find yourself dealing with constant bloating and gas that does not go away with over-the-counter remedies, it is time to consult a doctor. A study in the World Journal of Gastroenterology found that persistent gas and bloating were common symptoms among colon cancer patients. The study highlights the need for further investigation when these symptoms are present. 2. Blood in the stool. Seeing blood in your stool can be alarming, and it is one of the most common early warning signs of colon cancer. The blood can be bright red or darker in color, indicating that the bleeding might be from higher up in the colon. Blood in the stool can sometimes be attributed to hemorrhoids, but if it is persistent, it should not be ignored. For example, if you notice blood every time you have a bowel movement, it is crucial to see a healthcare provider. The American Journal of Gastroenterology reported that 20% of patients diagnosed with colon cancer experience rectal bleeding as a primary symptom. The study highlights the importance of early screening and diagnosis when blood is present in the stool. 3. Abdominal pain and cramps. Persistent abdominal pain and cramps can be a sign of colon cancer. This pain is often caused by a tumor obstructing the bowel. The pain can be dull and persistent or sharp and severe. It might be localized to a specific area or felt throughout the abdomen. If you experience consistent abdominal discomfort that does not go away, it is essential to get it checked out. Research conducted by the British Medical Journal found that abdominal pain is a presenting symptom in 44% of colon cancer cases. The study suggests that individuals experiencing unexplained abdominal pain should undergo a thorough medical evaluation. 4. Unexplained weight loss. Losing weight without trying can be a cause for concern. Unexplained weight loss is a common symptom of many types of cancer, including colon cancer. If you notice that you have lost a significant amount of weight over a short period, it is important to consult with a healthcare provider. For example, losing more than 10 pounds in a month without changes in diet or exercise can be a red flag. A study in the Cancer Epidemiology, Biomarkers, and Prevention Journal highlighted that 38% of individuals diagnosed with colon cancer reported unexplained weight loss prior to their diagnosis. The study underscores the importance of recognizing this symptom early. 5. Fatigue and weakness. Feeling constantly tired and weak, even after getting enough sleep, can be an indicator of colon cancer. This fatigue is often due to the body's inability to absorb nutrients properly or due to internal bleeding. Fatigue related to colon cancer is more than just feeling a bit tired. It is a profound exhaustion that does not improve with rest. For instance, if you find yourself unable to carry out daily activities or needing to nap frequently, it is worth discussing with a healthcare provider. The Journal of Clinical Oncology published a study indicating that 40% of colon cancer patients experience severe fatigue before their diagnosis. This persistent fatigue can significantly impact the quality of life and is a symptom that should not be ignored. 6. Iron deficiency anemia. Anemia, particularly iron deficiency anemia, can be a sign of colon cancer. This type of anemia occurs when you do not have enough red blood cells to carry oxygen to your body's tissues. Symptoms of anemia can include feeling extremely tired, shortness of breath, and having pale skin. If you experience these symptoms, it is important to get a blood test to check for anemia. A study in the Annals of Internal Medicine found that iron deficiency anemia was present in 15% of patients diagnosed with colon cancer. The study suggests that individuals with unexplained anemia should be evaluated for potential underlying causes, including colon cancer. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. 7. Narrow or ribbon-like stools. A noticeable change in the shape of your stool, particularly if it becomes narrower or ribbon-like, can be an early warning sign of colon cancer. This change can occur if a tumor is partially blocking the colon, causing the stool to pass through a narrower space. For example, if you notice your stool consistently appears thinner than usual, it is worth getting it checked. The Journal of Gastroenterology reported that changes in stool shape were a significant indicator in 17% of colon cancer cases they studied. This symptom, while often overlooked, can be critical for early diagnosis. 8. A feeling of incomplete evacuation. Feeling like you need to have a bowel movement even after you've just gone can be a sign of colon cancer. This sensation is often due to a tumor causing a partial blockage. This symptom can be frustrating and uncomfortable. For example, you might feel the urge to go to the bathroom multiple times, but only pass small amounts of stool each time. Research published in The Lancet Oncology found that 22% of colon cancer patients reported a feeling of incomplete evacuation. The study emphasizes the importance of taking this symptom seriously and seeking medical advice. 9. Changes in bowel habits. One of the earliest signs of colon cancer is a noticeable change in bowel habits. This can include persistent diarrhea, constipation, or a feeling that your bowel does not empty completely. According to the American Cancer Society, these changes can be a sign of a blockage in the colon, which may be caused by a tumor. Changes in bowel habits can vary greatly from person to person. For instance, you might find yourself suddenly needing to go to the bathroom more frequently, or conversely, you might struggle to have a bowel movement at all. If these changes last for more than a few days, it's important to consult your doctor. A study published in the Journal of the National Cancer Institute found that individuals who experienced changes in their bowel habits for more than 3 weeks were more likely to be diagnosed with colon cancer. The study emphasized the importance of paying attention to these changes and seeking medical advice promptly. 10. Nausea and vomiting. Persistent nausea and vomiting can be an early warning sign of colon cancer, especially when these symptoms are accompanied by other gastrointestinal issues. Nausea and vomiting can occur when a tumor causes a blockage in the colon, leading to a buildup of contents that cannot pass through. For example, if you experience nausea and vomiting that do not seem to have a clear cause, it is important to see a healthcare provider. Research in the Gastroenterology Review indicated that 14% of colon cancer patients experience nausea and vomiting as early symptoms. The study underscores the importance of recognizing and addressing these symptoms promptly. Colon cancer is a serious condition, but early detection can make a significant difference in treatment outcomes. Being aware of the early warning signs, such as changes in bowel habits, blood in the stool, and unexplained weight loss, can help you seek medical advice sooner. If you experience any of these symptoms, it is important to consult with a healthcare provider to rule out any serious conditions. Regular screenings and paying attention to your body's signals can be crucial in catching colon cancer early and improving your chances of successful treatment. Stay informed, stay vigilant, and remember that early detection is key. If you have any questions or comments, please feel free to leave them below. Thanks for watching.